today I'm really excited to introduce Dr. Margaret Rutherford. We're going to talk about perfectly hidden depression. Why is that different than other types of depression? What does that mean? And I can speak firsthand. Depression is just devastating for anyone who has it and who's trying their best to smile their way through it. It creates loneliness and despair, has its own common traits, but many health professionals misdiagnose it. We often say that depression is a symptom with many different causes, and yet it's often treated like the problem itself. And so I'm really excited to have Dr. Rutherford with us. And I just want to ask you before we start to think about this, all of our listeners out there, if you're suffering, tell us what you've learned. Post afterwards. What have you learned? Share this with someone. And how do you know if you or someone else is suffering, and what does that look like, and what can be done to treat it? So welcome, Dr. Rutherford.
Thank you. That's a lot of questions.
It is. And I want our listeners to be thinking about that.
Sure.
So before we start too much, I want to just read a little bit about you because I want to brag about you for a second, if that's okay.
Well, thank you very much.
All right. So Dr. Margaret Rutherford's been a psychologist in private practice for over 25 years. She's the author of Perfectly Hidden Depression. Will you hold that up for me?
Sorry, I missed my cue.
Yeah, it's okay.
I was reading the chat. There we go.
She's got a new book, Perfectly Hidden Depression, How to Break Free from the Perfectionism That Masks Your Depression, and this was published in 2019. She's been researching and writing on this topic for over 5 years. She's very passionate about this topic, and although depression can be heavily masked by perfectionism, its damage can still be devastating to someone who's trying so hard to smile their way through growing loneliness and despair. She's written for Huffington Post, Psychology Today, The Mighty Psych Central, the Gottman blog, Psychologies, Stigma Fighters, and so many more. If I read your entire bio, it would take up most of the show because you are very accomplished, but thank you so much for joining us. And I love that you are talking about this topic during a very challenging time for so many people.
Boy, it is. There's nothing like a pandemic to bring out a lot of people who are so stressed out about their lives continuing to look perfect, even though they are, adopting all different roles they'd never done before. And actually, the researchers that study perfectionism are very concerned about all the perfectionists out there that are trying to hide any kind of vulnerability that all of this has brought to all of us. So I'm delighted to be here too, Tana. Thank you so very much.
Oh, it's so great. And I love that we are talking about this so openly and helping other people talk about it. I heard a saying many years ago, and it made so much sense to me: pain shared is pain divided. And so there's just something about hearing someone else be vulnerable that makes it a little less scary and icky in ourselves.
Brene Brown, of course, has written eloquently about all this. And when I started all this, trying to find out what exactly was written about perfectionism and depression, I would have had to be under a rock not to find her work on mainly shame and vulnerability and perfectionism. And then was also some works, one by Terrence Real, that was on covert depression from men. He was sort of saying that maybe depression looked different in men, it was more covert. But I really couldn't find anything in the popular literature that combined perfectionism with depression and even suicidality. So, that's why I had written a blog post back in April of 2014, my just normal blog, thinking about some of the people that I had treated over the years that had this sort of odd combination of behaviors. They would come in and say, I don't really know why I'm here. Sometimes I get anxious, or I have an eating disorder, or, I'm using Klonopin too much at night to go to sleep, and maybe you can give me some sleep tips, that kind of thing. And then they sort of sheepishly look around and wait for me to say something. So when I had someone like that in front of me, what I began to ask was about their history, like you do anybody else. And what I began noticing, Tana, was that these folks would talk about really serious things, like maybe an alcoholic mom who then that person was forced to take care of their siblings, or neglect or abuse in the home, or moving around multiple times and going to, 8 different schools in 9 years or something that clinicians would call trauma. And I'd say, gosh, you have had a lot of trauma in your life. No, I've had many blessings in my life. I'm very successful. I have a great marriage. But then as they would talk about these things, in fact, one particular case was so poignant. she was talking about having been raped the week before she started college, and she was smiling as she said this. She said, "Yes, I've never really told anybody, and I really probably wouldn't have told you unless you'd asked me about some kind of sexual abuse. But I've never talked about it because it just didn't seem that important." And I looked at her and I said, "Do you realize that if I turned the audio down and I was videotaping you, I might have thought you were telling me what you'd done for fun last night?" And she looked kind of shocked. And I said, "I wonder how much you do that, how much you separate the pain of your life from of how you express things." Now, what I've later learned through studying the perfectionism research is that something that perfectionists do very well is that they can identify feelings. They can say, "Yes, I'm sad that my mother has cancer." But if you lead them to try to express that sadness, they have great difficulty. They're very analytical. They like to stay in their head, not in their heart.
Wow. Like what you just described. I think I told you I have this new book coming out that I wrote. It was my memoir. You described so much of what I wrote about in my own personal experience. And I have a feeling so many people watching, because I know women are perfectionists. We are. And
many of us are, yeah. And men. This is not a female only kind of thing, but it is definitely, the perfectionism reigns supreme for a lot of people.
Yeah. And I remember going through therapy, and when I was 12, so you'll notice I say this, and I tend to do what you just said. I'll like gloss over it. I'll say it really fast. I don't like really show a lot of emotion, and I'm trying to get better about that.
Good for you.
My stepdad climbed in bed with me.
Oh my gosh.
I went to therapy, and I'm talking about this. I'm like, "Yeah, but that's not why I'm here." She's like, she asked me something. I'm like, "That's not why I'm here." I'm like, "I wasn't really molested." And she was stunned. She's like, "I'm sorry." So I write about the story about what happened in my book, and I clearly was molested. But for 2 years, I couldn't say that I was molested. I could not say the word.
Right.
And I'm like, but I wasn't. I mean, so many other women had it worse. And so I always minimize it. And so other people have had way worse things happen to them. I wasn't chained to a radiator. I wasn't and I would go through the craziest list of things that didn't happen to me.
Sure.
Make it okay.
Yeah.
And then she looked the way you did a minute ago when you were talking about it. And she goes, "If someone did this to your daughter, what would you do?" And I lost my mind.
Sure.
I'm like, I would kill them. I'd rip their skin off. That's the first time I was ever able to acknowledge I had been molested.
And those are the things that you look for as a clinician. The sad thing and the very concerning thing, Tana, I have when I was writing the book and actually just trying to formulate my own ideas about this, what I ended up terming a syndrome of perfectly hidden depression, which is a group of behaviors and beliefs that kind of you always find together. Codependence is probably the most well-known syndrome. Mm-hmm. As I was writing about this, I was asking for volunteers to anonymously come forward and let me interview them because I was thirsty for information about just what caused this, what was it like to live with it. And all these people said, not all, about half of them had sought therapy for various and sundry reasons. And I want to say at least 90 to 95% of them were told, "You're just anxious, you work too much, you're not depressed, I'm so glad you don't have depression. That would really be bad. You just need to slow down." And one man's story was very poignant, and he said that he'd been given the Beck Depression Inventory. And one of the questions is, "Are you hopeless?" And he says, "No, not hopeless." Well, he tried to die by suicide 3 weeks later, and that doctor came to see him and said, What is it? You were in my office 3 weeks ago and you said you weren't depressed, you weren't hopeless." He said, "You asked me the wrong question. If you had asked me if I were hopeless, would I tell anyone? I still would have said no. And then that's where you have your answer, because that's a clue to all this stuff that has been very rigidly compartmentalized." The interesting thing is that a lot of these people that I'm trying to reach don't even realize that they are compartmentalizing, that they have almost dissociated from the pain of their lives, that it has become so automatic that it's just like one woman said to me, "If I have a problem that doesn't fit into the box I'm going to put it in and then put it in my emotional vault and stuff it in there, I build a bigger box," because they just have this sense of an intolerance, an inability, and actually a lack of skill of how to connect with those feelings.
Oh, that's
So
so
part of therapy is one, of course, you have to help the person realize that this perfectionism is something that they may have counted on as a childhood strategy to survive whatever was going on in their family, to hush the pain or the anger or the hurt or the fear and just completely push it away. That's how they survived, but that it does not work as an adult strategy for life. That you are living a very restricted, constricted life, that it doesn't have much freedom or openness, and certainly you shy away strongly from vulnerability.
Oh, yeah. I mean, everything you said just makes so much sense. I'm looking at the comments. I want to just acknowledge the people who are being vulnerable and leaving comments. We've got people from all over the country, but also we've got Canada, London. My friend from Rome is on there, Mexico. So thank you to everybody who's logging in. I
Yeah,
knew
hi from Arkansas.
what was that?
I said hi from Arkansas. That's where I'm
Yeah, I
from.
mean, I knew this was going to be a big topic, so I'm just so grateful that you are on. And there's people just writing about some crazy stuff they've been through. So, I often say social media can be, it's definitely got its downsides, but it has its place in helping people as well. Sometimes
Yes,
people
yes.
can't say things out loud. Maybe that's how they start, is by reaching out to someone either via email or on social media. Maybe they're able to open up that way the first time. I don't know. What do you think?
Oh, sure. In fact, I have a Facebook closed group myself, and a lot of those people are there because they are risking beginning to talk about this perfectly hidden depression that they identify with. I want to make sure people know it's not a diagnosis; it's a syndrome, or as the way I have thought about it. And so it's just the people are blossoming by being able to talk about how they really feel and what they're really disturbed about, or what kind of things have happened to them, and they can just get supportive comments. So yes, I do think it's a very helpful thing. I think it's important to realize that no Facebook group or support group online is a substitute for a therapeutic situation where you've got someone right there who's tuned in and trained to help you through, especially trauma. And there are all kinds of very specific traumatic or trauma techniques, EMDR, DBT, all those kinds of
That's what
things,
works
brain
for
spotting. Yeah, all of those things are really at the forefront of good therapeutic treatment for trauma. So my book isn't a replacement for that. My book is simply, and the message more than the book really, is one that we cannot afford to keep on ignoring or discounting or denying that this kind of presentation of depression is being missed, and that people are dying because of it. There are researchers in Canada that have shown very distinctly that as perfectionism rises in our culture and internationally, so does suicidality, and they're rising together. And
Mm.
they're rising in all age groups except for those 65 and older. So I think it's just very important, and this is a great discussion. I'm so glad people from all over the world are hearing this, because I've been reached by people from all over the world. Just last week, I did a podcast interview from Toronto and one from London, and it's just been very gratifying to know that this message is getting out.
I love that you're shedding light on it. And I think the more that we talk about it, we destigmatize it. And I think that that's really the important point. My husband just wrote a book, The End of Mental Illness. And of course, he got no end of grief. It's not because he's saying we can end everything happening. It's because he's saying we need to look at it differently. We need to think about it differently. We need to stop calling it mental illness so people will actually reach out and get help.
Right.
Start thinking of these things and looking for different clues. And I love that, it's people like you, it's people like my husband that are trying to destigmatize this, shed light on something that if you had chest pain or you broke your arm, you wouldn't think twice about going to the doctor.
Right.
So
I think, to use a medical analogy for this as well, when you think about cardiologists, and years ago when they only studied men for a heart attack, a woman would come in with certain symptoms and they'd say, "Oh, you're not about to have a heart attack. That's something else." Well, now they've studied women. And so the rubric or the awareness of what constitutes a signal for a potential heart attack is much wider, is much more diverse. That's what I'm trying to do with depression. is to say, yes, depression can look classic. It can look like anhedonia or not having pleasure in previously pleasurable activities. You
Mhm.
can have depressed mood. You can have hopelessness and helplessness. A lot of the things that you said that you yourself have suffered from. But clinicians can also have, or your friends or your parents can see this in their children, or you can see it in your partner, that they have losses or they have struggles and they never seem to be able to express the pain of it. And so, we can begin to recognize it in one another and in ourselves and perhaps prevent some of these tragedies that are happening. Not to be overly dramatic, but this is a real story. Back in mid-May, I was contacted by some women from Florida who, one of their friends, who was a very successful mother of three, loving, engaged in the community, just at the brink of what everybody thought her potential was, and she killed herself suddenly. And they found my book on her nightstand. So she was looking. I mean, when I heard that, Tana, I couldn't breathe for a second.
I bet.
And we have ended in her memory and in her honor. We have done a series of discussions about perfectly hidden depression in her honor, Florida.
Oh, wow. And I'm these messages are continuing to pour in. So thank you to everybody. We will try and get to some of your messages. And if you would like to reply to any of these later, Dr. Rutherford, you can do that.
Of course.
There's just amazing people writing in some great stuff. And we're going to give you a way to reach out to Dr. Rutherford if you would like, how to find her.
You bet.
Are you doing telemedicine now?
Yes. Okay. I've been doing telehealth since March, and actually have found out. I mean, I had done it occasionally with the occasional patient who, was on a vacation, was in another state or something like that. But I would love to hear from your listeners and answer all the questions I possibly can. My email is askdrmargaret@drmargaretrutherford.com. If a whole lot of you email me, then I may not be able to get to it for a while, but that's askdrmargaret@drmargaretrutherford.com. I try to be very responsive to people.
That's so giving and generous for you to give out your email. Yeah, so we aren't going to be able to answer all of them on the show, but I'm watching, I'm paying attention. I am impressed that people are actually sharing this much. And so we are going to try to reach out to you, just so you know. So how did you come to identify the perfectly hidden depression? Why do so many people miss it? And I'm just curious,
well, people miss it in themselves because, if there is constructive perfectionism. Perfectionism in and of itself is not a bad trait to have. In fact, many successful people, I have to have cataract surgery, and the guy said, "Well, I'm kind of a perfectionist," and I said, "Good, I'm glad you're a perfectionist." That's a good thing. You just be as OCD as possible. Right. So, but the difference between constructive perfectionism and destructive perfectionism is that the first, there is a sense of wanting to do your best, but you can handle if you fail. It's just a very process oriented thing. You're sort of trying to beat your best. And that's just something that's meaningful for you to do. A destructive perfectionist, it's not about process. It's about achievement. It's about the goal, because they have this constant editorializing in their head, probably, in my view, born from messages they got from childhood about the fact that they're really losers. They should be ashamed of themselves. They're going to get found out, if they don't really do well. And so they're constantly on this treadmill of having to meet the expectations of other people. And that treadmill keeps going, and the expectation this next is even more, or even, higher, and then even higher, and then even higher, to where these people get so lonely and despairing because no one really knows them. No one knows what makes them tick. No one knows what's in their heart. In fact, I will tell you, those people that reached out to me that I interviewed, I said, why would you reach out? Why would you risk talking to me, a stranger, and telling me your story? And to a T, they said, because we don't want anyone else to live the life that we have lived. It is far too despairing. Yeah.
Yeah, no, I know that was part of the motivation for me to write my book. I had to wait till my daughter was old enough. There were all these things, criteria I had to meet to be able to write the book, because it's gritty. It's very gritty. And I was even surprised myself that I wanted to write it, but I thought, if one person, and whenever you write something, you're going to get criticized.
Oh, yeah, I've
Um,
definitely been
oh
criticized.
yeah, it's just everybody's got a voice now. And so, but I thought, it's worth the criticism. It's worth the risk of putting it out there if one person looks at it and goes, I'm not so bad. I'm not alone. I can, my life can be better. And so that was really the motivation to do that. And I really do think that when we share our stories together, it's just that pain shared is pain divided.
Well, I really tried to model ever since I've been on social media, which has been about 8 years now. I've been trying to model that kind of transparency and vulnerability. This isn't funny to say, I have 3 letters after my name, but I also have gotten divorced 3 times, and not proudly, but now my husband of 30 years, and I think we're going to stick. But I had a very chaotic decade there. But what I've learned is the definition of self-acceptance for me is that your vulnerabilities do not define you any more than your successes do, or vice versa. So those are
and
3 facts about me, or 2 facts about me, but I can talk about them both freely and realize, maybe I'll get judged for that, but that's really not in my control. What is in my control is for me to be okay with that, and to realize that I feel remorseful about the mistakes I've made, but I also can be proud of things that I've done well, or that, and writing this book has been such a passionate a goal for me,
I
because
love that.
it's been I've carried a full load as a therapist while writing this book, which, and my primary care physician said, "I think it nearly killed you, Margaret."
Yeah.
And I think it did.
It's
You may have had the same
we
experience with
understand
writing
that.
your book. Yeah. Mhm.
Yeah, we understand. But it's also born. It's a little like having a baby when you write a book. It's like the pregnancy, the birthing process, the pain, the labor, and then you got to nurture it.
That's
So
right.
it's a lot, but it's also you're very attached to it. So it's great. One thing I learned, there were 2 statements actually that I really meditated on and took to heart. It's no one else's job to love me. It's mine.
Yeah.
And that really helped me. It's like, it's no one else's job to love me. It's mine. And in fact, what other people are thinking about me is none of my business. And
And you don't have any control over it.
I'm like, it's just somehow it took me a while to get it, but it really helped me. It just sort of freed me.
There was a period of time for about 3 or 4 days, as again, I'd never written a book. I didn't know what to expect, but I just hit a wall. I hit a wall that said, this is going to be criticized. As soon as I turn it over to the publisher, I'll think about something I'd forgotten, or I'll learn something that I didn't know, or I'll disagree with myself. And I
Right.
was just absolutely paralyzed. And then what I did was I just sat down one early morning and wrote about that feeling of paralysis, and that sense of, I'm going to write a book that will be imperfect
Yeah.
in order to address people's perfectionism. And I had to get very comfortable with that. And then I wrote the rest of the book. And in fact, I included those 2 paragraphs in the book itself.
I love it. I love that. And the other thing that I always like to tell people is, because some new research will come out and then people will criticize something you wrote before. And it's
Oh,
like,
yeah.
don't be attached to, I'm not attached to my message. I'm attached to educating and being
To
educated,
the process, right.
because it's going to change. We hope it changes, because that means that research is continuing and people are learning, and we want that to happen. But
I do want to say that the book is not just a book, it's also sort of a workbook. But
Mhm.
there are a lot of workbooks on perfectionists trying to change. But I hope that what's different about this one is it also talks about the why. To me, you can't pull up a weed if you don't get the root.
Yeah.
So, we're not just changing or trying to heal the habits of perfectionism. We're trying to heal why you began feeling like you had to be perfect, or act perfect, or look like you had the perfect life in the first place. I'm sorry, I interrupted you. I didn't mean to.
No, please do. You are the expert, and I'm so enjoying all of your advice and input, and just everything you're talking about. I know people are going to greatly benefit. If you could show your book one more time, I want to show it.
Sure, of course. My pleasure.
Yeah. So, perfectly hidden depression. So I love this. One thing, it's just resonating so much. I'm watching the I'm watching the comments come in, so I know it's resonating with them too, because they're just like pouring in. So it's fantastic.
Thank you for everybody for that. And I don't know exactly. You'll have to explain to me afterward how I can actually respond to those, because I'd love to.
We'll do that. And
Okay.
I remember when I was younger and I was just, I started to find myself, I felt I needed control. And I think when I was young in my teenage years, I found that through eating disorder. And then I realized I didn't want to keep doing that. And so, so I want to keep doing that. So then I switched it to exercise. And then I figured out that if I put this facade on, if I spent 2 hours with paint and lacquer in the mornings and I like painted this wall, I literally thought of it as a wall. It was a shield.
Yeah.
People couldn't see what I was really going through, and they wouldn't want to know me if they did know. Like they wouldn't like me if they did know me.
Oh,
having those thoughts. Like, I need to do this because if they really knew what was going on, they wouldn't want to be around me.
And then, of course, I furthered that whole problem by marrying a couple of people who agreed with that comment, that if people really knew me, they wouldn't like me. I just found other people that agreed with my inner criticism. So
yeah. And you will always be able to find those. But it sounds like you found one who didn't, and like I did.
I did.
And who just, he'd always look at me and go, "You're amazing for everything you've been through." And I'm like, "Have you been listening at all?" I don't know who you're talking to, but
well, my husband has such a great sense of humor. After 30 years, he still calls himself my current husband. So
so great. It's so great. I love it so much. That's so fantastic. So can you give people, we've got 3 minutes left. Do you have a tip that you can give anybody, or a strategy, or even a resource you can give people that are listening? And
well, if you've never watched any of Dr. Brene Brown's stuff, she has a presentation right now on Netflix that is outstanding. And of course, her TED Talk is one of the most watched ever. As far as a tip is concerned, I really think that the beginning of trying to address this is to realize that there are rules you are following that you just no longer need they're no longer helpful in your life. And so one of the stages, there are 5 stages of treatment or healing. One is consciousness. It's becoming a problem. You can see it's a problem. One is commitment. Commitment's very hard with perfectionism because there's so many hurdles, and it's your best friend, and it's how you've been successful, or how you think you've been successful. But the third one is about how to assess the rules, the shoulds, the oughts, the have-tos, the musts, the nevers, the always. And if you really look at some of those rules, you'll see, wow, why am I doing this? I mean, I was told that this was, I'm a storyteller. There's a great story of a woman who was cutting the edges off her ham, and her husband said, "Why do you do that before you cook it?" He goes, "I don't know. That's what my mother always did." And so they call the mother. "Well, why do you do that?" "I don't know. That's what my mother always did." So they call the grandmother, and she just starts guffawing. She goes, "Because my pan wasn't big enough."
Yeah, exactly. So great.
So they had followed these rules, and they were still, that just were obsolete. So if you're interested, the book is a workbook. It's also hopefully explains all of this in detail. I would be very honored to have you read it. It is not expensive. It's available in paperback, ebook, and audiobook. So I hope it helps people. I've been honored to get the message that it has, and I just don't want there to be any more, or at least quite a few less, of those people, those women like I heard about in Florida. I'm ready for that to stop.
Oh, I'm so grateful to you for sharing this and opening this up. I love this topic. So Dr. Margaret Rutherford, let's put her information. You can find Dr. Rutherford at drmargaretrutherford.com. The Self-Work Podcast, she has a podcast. Facebook and Instagram, Dr. Rutherford. And she's got other social media as well. If you are struggling with depression, it sounds like Dr. Rutherford, you can reach out to her. She takes patients through telehealth. We do as well. If you are really struggling, our number in the clinics is 844-818-0616. Depression has doubled during COVID.
Suicide calls have gone up 1,000%.
Exactly. And so we don't want you suffering. And for more information, and also if you want to share this, you can also go to tanaamon.com get more information if you missed anything on Dr. Rutherford, and you can also see some of my tools that I have there. So don't miss out on next week. Next week, I've got a very special guest as well. And really quickly, I have some winners. I have winners of the Brain Warriors Way course, the 6-month course that my husband and I walk you through to get healthy. And that is for Alessia O'Neill, Michelle Chen, and Brenda Stacer. Please do not post publicly. Private message me for details. And that's a $400 value. So if you tag 3 people, if you share this message that we did today with Dr. Rutherford and you tag 3 friends, it enters you into a drawing to win that course. So please don't miss next week, and we are looking forward to it. And thank you so much, Dr. Rutherford.
Thank you, Tana. I appreciate it very much. And thank you to everyone who's listening. The name of the book someone just asked is Perfectly Hidden Depression.
Perfect.